South Africa's coronavirus cases have breached the 200,000 mark. The health department says it's encouraged by the number of recoveries. More than 97,000 people have recovered from the virus. This translates to a recovery rate of 47.6%. One of those who beat COVID-19 is Johan Steyn. He is patient 61. Johan, good evening and thanks for joining us tonight. Talk to us about your journey now that you can look back at it retrospectively.
Yeah, hi there, Cathy. Hi there to all the viewers. It was a scary journey, hey, because, when this thing broke out, it was lots of uncertainty. I didn't know what was going to happen. Am I going to die? At least now we're a bit more informed. We can see the progression. We can see some statistics. So things are going better. But I must tell you, it took me 39 days to get over the coronavirus. The Department of Health tested me 4 times. All of those were positive. Then, luckily, like I said, after 39 days, I finally got cleared, and my wife and daughter could move back into the house. So, looking back at it, what an experience. But here I am. All is good on my side, at least.
Johan, 39 days, it's over a month. It's a long time to be alone, sick, and unsure about what the future holds.
Yeah, that's spot on, and the problem with this disease is it gets better. So you feel, okay, I'm getting there, and you wake up one morning and you're absolutely tired. It feels like you just reset from the beginning, and then you start getting nervous. Why is this not getting better? Then it takes another couple of days and you start getting better. So that's what makes it really tricky, I think.
Talk to me about the response of your family and even the community that you're in to the fact that you had tested positive for COVID-19 and what the impact of that was on your recovery.
Yeah, you know what, it was difficult. My wife and daughter, so my wife is a doctor, she's actually on the front line. They had to move out of the house, very difficult. Now I'm by myself, I've never been by myself, to be honest with you. But my friends and family and support network neighbors, they made a real difference. They left groceries outside my door. They made me food, our neighbors across the road. Made it so much easier to get over this thing.
And, many South Africans are unsure about what it is that they're going to do when they have people close to them testing positive for COVID-19.
Yep.
And it's starting to happen more and more that these cases are closer to home. It's no longer something that's being reported in another province, but now you may have a friend of a friend who knows somebody that has tested positive. So the degrees of separation are becoming closer to home than they were before. And I'm just keen to know how can people best support somebody who does have COVID-19? I know you can't speak for everyone, but perhaps just from your own experience.
Just be there for those people. Pick up the phone, see how they go, how they're doing. Like I said, if you can make them dinner or drop groceries, just be there. Just have that sort of Ubuntu spirit. Let's be there for each other. That's what I think.
And mentally, how did you cope?
Sure. Yeah, it was tough. I started getting a bit crazy, I think, after say 20 days, because you don't know when this thing's going to end. But I kept in touch with work. I'm fortunate enough to be able to work remotely. So I think I took on more work just to keep my mind engaged. But it was tough. I must say, this mental thing is maybe even worse than the physical side of the disease.
Did you have to develop some kind of routine to help you get through your days, or were you just, figuring it out as you went along?
The worst thing is that I started waking up later and started going to bed later, and my whole routine got thrown off. And then, some people at work actually said, "Hey, Johan, you know what? You have to stick to your old routine. Wake up early, do a bit of exercise if you can. Do your meetings, get through the day, and then normal time, 5:30 or whatever, stop working, watch some TV." And once I got back into that normal routines, things seemed to get better.
All right.